Welcome to another deep dive. Today, we're going to be venturing into a really groundbreaking area of cancer treatment.
Oh, wow.
Microbeam radiation therapy,
Okay.
or MRT for short.
All right.
And it's a technique that is so precise. It's so focused that it almost sounds like something straight out of a science fiction novel.
It really does push the boundaries of what we thought possible with radiation.
Yeah.
Instead of using these broad beams of radiation that we're kind of used to thinking about,
Yeah.
MRT uses these incredibly thin, highly focused beams,
Right.
almost like microscopic lasers, to target tumors with extreme accuracy.
And what makes this deep dive even more exciting is that the research that we're exploring focuses on a veterinary trial
Right.
using MRT to treat brain tumors in dogs.
That's right. This study was conducted at the European Synchrotron Radiation Facility,
Wow.
and it involved 7 dogs that were suspected of having gliomas,
Okay.
which is a type of aggressive brain tumor.
Wow.
And the results are, to put it mildly, remarkable.
Okay, I'm hooked already. But before we dive into the results, let's talk about why dogs are such important subjects for this kind of research.
Sure.
Why not just start with human trials?
Well, dogs actually develop spontaneous brain tumors that are very similar to those found in humans. So this makes them invaluable models for studying the effectiveness and safety of new treatments, like MRT.
Okay.
It gives us crucial data before moving to human trials.
So these dogs are true pioneers, paving the way for potential breakthroughs in human cancer treatment.
Absolutely.
Can you tell us more about the specifics of the trial?
Sure.
What exactly did they do?
Well, each of the 7 dogs received a single fraction of 3D conformal image-guided MRT.
Okay.
That means that the radiation was meticulously targeted to the tumor using advanced imaging techniques, and it was all delivered in one session rather than the typical multiple sessions over weeks.
That already sounds so different from conventional radiation therapy.
Yeah.
And how exactly did they deliver the radiation with such precision?
Well, they used 5 different irradiation ports, essentially delivering the radiation from 5 different angles. So imagine trying to illuminate a small object in the center of a room.
Yeah.
Using multiple light sources from different directions ensures that the entire object is lit, right?
Right.
It's a similar concept here.
So it's all about maximizing the coverage of the tumor
Yes,
while minimizing exposure to the surrounding healthy brain tissue.
exactly. And that's where the real magic of MRT comes in.
Okay.
The high peak and low valley dose.
All right.
So the peak dose, the radiation delivered directly to the tumor within each microbeam, was incredibly high,
Okay.
between 20 and 25 gray.
Wow.
But the space between those microbeams, the valley dose received a much lower dose, only 2.8 gray in this trial.
Okay. Help me wrap my head around this.
Yeah.
How can such a high dose be safe?
Yeah.
Wouldn't it damage the surrounding brain tissue?
That's the crux of the matter.
Okay.
The high peak dose is thought to effectively destroy tumor cells, disrupt their DNA, and stop them from replicating. But because those microbeams are so incredibly thin and focused, the damage to the surrounding tissue, where the valley dose is much lower, is minimized.
It's like a microscopic surgical strike, targeting the tumor cells with pinpoint accuracy while leaving the surrounding healthy tissue largely unharmed.
Precisely, and that's why this trial was so crucial.
Okay.
The primary goal was to evaluate the safety of this technique in dogs, specifically how well the normal brain tissue tolerated this high peak, low valley dose approach.
So did the dogs experience any negative side effects from this treatment?
Remarkably, during the first 3 months of observation, none of the dogs showed signs of any harmful effects from the radiation.
Wow. That's truly remarkable. No side effects at all.
Well, some dogs did experience some mild temporary side effects immediately after the treatment.
Okay.
A few had partial seizures, but these were easily managed with medication and resolved very quickly.
So overall, the treatment was very well tolerated.
Yes.
But that's just one side of the coin.
Right.
The burning question is, did it actually work? Did MRT shrink the tumors?
The answer is a resounding yes, and the degree of shrinkage was frankly astonishing.
Okay, don't keep me in suspense. Tell me everything.
On average, the tumors in these dogs shrank by 69% 3 months after receiving just a single MRT treatment.
Really?
Imagine a single treatment shrinking a human brain tumor by that much.
Wow.
This is why this trial has everyone so excited.
69%, that's incredible.
It is.
So not only was the treatment safe, but it was incredibly effective at shrinking the tumors.
Yes.
Were there any other benefits observed?
Absolutely. The researchers also noted significant improvements in the dog's quality of life after MRT.
Well, that's great.
Their owners reported positive changes in their overall well-being and behavior.
That's heartwarming to hear. It must be such a relief for the owners to see their beloved companions feeling better.
Yeah.
And those partial seizures we mentioned earlier.
Yes.
Was there any change after the MRT?
There was a noticeable decrease in seizure activity after MRT, which, as you know, is a major symptom associated with brain tumors.
So MRT doesn't just shrink the tumors.
Right.
It also helps to alleviate debilitating symptoms and improve quality of life.
It does.
This is truly groundbreaking, but we've only scratched the surface of this deep dive.
Yeah, there's a lot more.
There's so much more to unpack, from the technical details of the treatment delivery to the potential implications for human cancer treatment.
Absolutely. This trial was a critical step towards using MRT in humans.
Right.
The results are incredibly promising, but researchers are still working on dose escalation studies to determine the most effective and safe dose for future treatments.
So they're trying to find that sweet spot, the dose that knocks out the tumor without harming the patient.
Exactly.
But this level of precision and technology makes you wonder, how accessible is MRT right now?
That's a great question right now. MRT requires specialized equipment, specifically a synchrotron, which is a large, complex, and expensive facility, not exactly something you find at your local clinic.
Yeah, I remember reading that the trial was conducted at the European Synchrotron Radiation Facility. That doesn't sound like your average doctor's office.
Exactly. But there is ongoing research focusing on creating more compact and affordable MRT systems.
Oh, wow.
The article even mentions some promising advancements using compact synchrotron X-ray sources and field emission X-ray source arrays.
So there's hope that MRT could become more widely available in the future.
Absolutely. It's an area of active research and innovation. I'm optimistic we'll see significant progress in the coming years.
That's good to hear, but let's talk long-term effects.
Sure.
The study only followed the dogs for 3 months. What about potential side effects that might show up later?
That's another valid point. While the initial results showed no signs of harmful radiation effects, longer-term studies are needed to fully evaluate MRT's safety profile.
Okay.
Researchers will need to monitor for any delayed side effects.
So we need more data, more time to see the full picture. But even with these unknowns, this veterinary trial represents a significant milestone in MRT development.
Absolutely. It's a shining example of how scientific curiosity and technological innovation, coupled with compassion for both animal and human health, can lead to groundbreaking medical advancements.
And the study also delves into some specific details about the dogs in the trial.
Mm-hmm.
They chose dogs suspected of having gliomas, and those tumors had to be a certain size, less than 33 millimeters in diameter. Why those specific criteria?
Well, gliomas are particularly aggressive, often not responding well to conventional treatments.
Okay.
These dogs represented a population that could potentially benefit most from a new approach like MRT.
Makes sense. And the size restriction.
Likely due to the limitations of the MRT equipment at the time. Remember, this is a cutting-edge technology still in its early stages. Researchers needed to ensure the beams could effectively target the entire tumor. Larger tumors might have been more difficult to treat with the available equipment.
So these criteria helped ensure the study's scientific rigor and increase the chances of seeing a positive effect.
Exactly. Focusing on a specific type and size of tumor allows for more controlled variables and more accurate conclusions about MRT's effectiveness.
And this study also mentioned that the dogs received medications like phenobarbital and corticosteroids in addition to MRT. Why was that?
Yeah. Well, those medications help manage the symptoms of brain tumors like seizures and inflammation. Phenobarbital is an anticonvulsant to prevent seizures, while corticosteroids like prednisolone help reduce brain swelling.
So they weren't just evaluating MRT in isolation,
Right.
but also how it worked alongside standard supportive care.
Precisely. It's about understanding how new treatments fit into existing protocols and whether they improve outcomes for patients already receiving other forms of care.
It's not always about replacing existing treatments, but finding ways to integrate new approaches to make the overall care more effective.
Exactly. And here, the combination of MRT with these medications seemed to be very effective. The dogs experienced significant tumor shrinkage and improved quality of life.
And the researchers carefully monitored the dog's medication dosages throughout the trial. They even adjusted the phenobarbital dose to ensure blood levels remained within a therapeutic range that speaks volumes about the attention to detail and the high standard of care in this study.
Absolutely. They wanted to be sure any observed effects were attributable to MRT and not to fluctuations in medication levels.
It's also interesting they didn't perform biopsies on the dogs to confirm the diagnosis of glioma. They relied on MRI imaging and expert evaluation.
That's common practice in veterinary medicine, particularly with brain tumors. Biopsies can be risky, especially in the brain, and the information gained doesn't always change the course of treatment.
So it's about balancing the potential benefits with the risks involved.
Yes. In this case, the researchers were confident in their diagnosis based on the MRI findings and the clinical presentation of the dogs. Plus, they had a board-certified veterinary neurologist and a neuroradiologist review the images to confirm the diagnosis.
So while a biopsy might provide a definitive diagnosis, it's not always necessary, especially when the risks outweigh the potential benefits.
Right, and in this trial, the focus was on evaluating MRT's safety and effectiveness. So a definitive histological diagnosis wasn't essential to achieving those goals.
And the study also provides a detailed breakdown of how the MRT treatment was planned and delivered. It mentions using a volumetric CT scan, merging the CT and MRI images, and contouring the tumor and surrounding organs at risk. It sounds incredibly complex.
It is. It's like planning a highly intricate surgical procedure, but instead of a scalpel, they're using beams of radiation. The volumetric CT scan allows them to create a 3D model of the brain, pinpointing the exact location and shape of the tumor.
So it's like having a GPS for the radiation beams.
Exactly. By merging the CT and MRI images, they can define the target area, the tumor, and the areas they want to avoid the organs at risk.
And what are those organs at risk in the brain?
Structures like the optic nerves, the brainstem, and the pituitary gland. These are highly sensitive to radiation. Even small doses can cause damage.
So avoiding these areas is critical.
Absolutely. This detailed mapping and contouring process is crucial. It allows them to deliver the highest dose of radiation to the tumor while minimizing the dose to surrounding healthy tissue, especially those sensitive organs at risk.
So it's like a delicate dance between advanced technology and biological vulnerability.
It truly is, and it requires sophisticated software and expertise to ensure the radiation is delivered accurately and safely.
The study also mentioned a planning target volume, or PTV. What is that?
The PTV is a slightly larger volume encompassing the tumor itself. It accounts for the potential for microscopic spread of tumor cells beyond the visible borders. Think of it as adding a safety margin.
Like casting a wider net to ensure they don't miss any stray tumor cells.
Precisely by targeting the PTV, they increase the chances of completely eradicating the tumor and preventing recurrence.
And the prescribed dose in this trial was 2.8 gray to the PTV.
Yes, but remember, that's the minimum cumulated valley dose. The peak dose within the microbeams delivered directly to the tumor was much higher, around 20 to 25 grays per port.
Right, that high peak, low valley dose approach we talked about earlier.
Exactly. This specific dose was carefully chosen based on preclinical studies in animals and was considered safe for normal brain tissue while still being effective at destroying tumor cells.
It's fascinating to delve into these technical details and appreciate the level of precision and planning that goes into delivering MRT. It's truly a remarkable convergence of technology, physics, and biology.
It really is a remarkable feat of interdisciplinary collaboration, and the fact that they were able to translate this complex technique from the laboratory to a clinical setting, even in a small veterinary trial, is a tremendous achievement.
Absolutely. It gives us a glimpse into the incredible potential of this technology and what it could mean for the future of cancer treatment. This study really emphasizes the incredible level of precision involved in MRT.
Yes.
It even mentions using things like thermoplastic masks and fiducial markers during treatment.
Right.
What exactly are those?
Well, those are essential tools for ensuring pinpoint accuracy during the radiation delivery. The thermoplastic mask is a custom molded headpiece that keeps the dog's head perfectly still throughout the procedure.
I'm picturing like a tiny helmet specially fitted for each dog.
Exactly. It's made from a material that softens with heat, so they mold it to the exact shape of the dog's head, and then it hardens as it cools, creating a secure and comfortable fit.
So it prevents even the slightest head movement.
Yeah.
Which is crucial when you're dealing with radiation beams thinner than a human hair.
Precisely, even the tiniest movement could affect the targeting and potentially expose healthy tissue to those high-dose beams.
And what about the fiducial markers? What role do they play in this high-tech setup?
Fiducial markers are small radiopaque objects, often metal, that are implanted near the tumor, and they act like tiny beacons that show up clearly on imaging scans.
So they help pinpoint the tumor's exact location in real time during the treatment.
Exactly. The imaging system tracks these markers and adjusts the radiation beams accordingly, ensuring the tumor remains the target, even with minor movement.
It's mind-boggling how they can control something so powerful at such a microscopic scale.
It is.
But this precision is not just about the technology, it's about protecting the healthy brain tissues surrounding the tumor.
Absolutely. And that brings us to another fascinating aspect of MRT.
Okay.
The speed at which they delivered the radiation. The study mentions flash dose rates, thousands of grays per second.
Wow.
That's significantly faster than conventional radiation therapy.
Flash, it does sound incredibly fast.
Yeah.
What's the advantage of delivering the radiation so quickly?
Well, early research indicates that flash radiotherapy might spare normal tissue from radiation damage while effectively killing tumor cells.
How is that even possible?
The mechanisms are still being studied, but it's thought that the rapid delivery triggers different biological responses in healthy and cancerous cells. This could lead to a protective effect in normal tissues.
So flash radiotherapy might reduce the side effects we often associate with radiation therapy.
That's the hope, however. It's still in its early stages of research, and we need more studies to confirm its safety and effectiveness in humans.
But the fact that MRT can be delivered at these flash dose rates is intriguing, adding another layer of potential benefits to this already promising technique.
Yeah, it truly represents a paradigm shift in how we think about radiation therapy. We're moving away from broad beams and fractionated doses to a more targeted, precise, and potentially less toxic approach.
This deep dive has been a revelation.
It has.
We've uncovered so much about MRT, from its intricate technical details to its potential to revolutionize cancer treatment.
Yeah, the results from this veterinary trial offer tremendous hope for humans battling brain tumors and other cancers.
It's inspiring to see how scientific ingenuity and compassion for both animal and human health can lead to such groundbreaking advancements.
Indeed, and it emphasizes the importance of continued investment in research to explore new frontiers in medicine and push the boundaries of what's possible in treating diseases like cancer.
From Veterinary, keep those minds-inspired hearts light and tails wagging.